At this time, please join me in welcoming a friend of the Hispanic community and of the Community Health Center movement, a champion of healthcare reform, the former governor of the state of Kansas, the 21st United States Secretary of Health and Human Services, the Honorable Kathleen Sebelius.
We talk a lot about how the Affordable Care Act is strengthening community health centers, which are the backbone of our healthcare system, especially for Latinos and other Americans who are trying to access great primary care. But being here at the heart of that care delivery is really very exciting for me. What we know is community health centers deliver high-quality primary care to anyone who walks through the door, whether they have private insurance, public insurance, or no insurance at all. In New Mexico, 62% of health center patients are Latino. People visit health centers for regular doctor's visits, but they also go for a variety of needs: dental care, diabetes management, counseling, filling a prescription. And community health centers do it all. But they do it all on budgets that are far smaller than those available to larger hospitals and health systems. So it makes it one of the best investments we make in primary health care. Under the Affordable Care Act, we're investing $11 billion over the next 5 years to help renovate, expand services, build new facilities, add new technology, and train staff. And in the brief tour I was able to do just a few minutes ago, talking to Stella, who has been a nurse for, what did she say, 35 years, 40 years?
45.
45 years, thank you. 45 years, but her experience first in an emergency room and now at the health center is, I think, a great snapshot, because she said that the patients she sees here and is able to deal with here and find a primary health care home here used to come through the doors of an emergency room. So when people say, how do you improve care and lower costs, that's exactly the snapshot, is actually getting folks connected to a health home, making sure that they have preventive care on a regular basis and don't come through the doors of an emergency room. So thank you, Stella, and all the First Choice staff. Already, thanks to the healthcare law and other Obama administration investments like the Recovery Act, community health centers are already serving 3 million more patients today than we were in 2009. 3 million more, and some of them are coming through. And that includes 1 million more Latino patients. So across the country, we've added thousands of new primary care providers thanks to expanding the ranks of the National Health Service Corps, which are being tripled over the next couple of years. And to me, this is one of the real win-win-win situations. The National Health Service Corps is the Peace Corps for healthcare workers. And the deal is, if you agree to serve in an underserved area, the United States government will help pay off a loan or provide a scholarship, allowing a lot of very talented providers, and you're going to hear from some today, to actually do the work that they love and be in communities that they want to serve. And 167 of those healthcare providers are serving right here in New Mexico. We've made grants to improve the diversity of the healthcare workforce. And what we know is those investments don't just improve health in a community, they're also a great boost to the local economy, creating good jobs first in construction, so as these sites are built and expanded, those construction jobs occur, but then ongoing jobs in healthcare. So New Mexico healthcare centers have employed more than 2,100 staff over the last year. And nationwide, community health centers have already added 25,000 jobs since 2009. First Choice Community Health Care is clearly a wonderful example of how our investments in community health centers are making a difference. The Affordable Care Act funding will help add 23 full-time equivalent medical and support staff. And earlier investments in the Recovery Act passed in 2009 added nearly 12 new full-time equivalent medical and support staff, and allowed for the new South Broadway site's construction. So I want to thank everybody for being here today. I'm really eager to hear the panel's discussion. I want to make sure you know that one of my great colleagues is with us today. March Petty is the Regional Health Director for this region. Marge is here. Marge is on the ground working with a several state region, but includes the state of New Mexico and is in and out of the state on a regular basis. And I'm now eager to hear about the patients and the community, and I want to turn over the microphone to Dr. Valerie Romero-Leggett to be our MC for this morning.
Thank you, Secretary Sebelius, for those comments, and really making the point here again that our community health centers really make a true difference in the health of the communities that they serve. And I really wanted to also pick up on the point that you were talking about the diverse workforce, because these community health centers also are models for training our health professionals, our homegrown, which you'll hear from today, in this integrated, team-based, community-based model that's just so critical for really good culturally competent care, linguistic care for the communities and the people that they serve. So I'm very excited to, again, hear from our panelists as well. So I'd like to introduce our first panelist, who is Dr. Kaylee Cohn. She's actually a native New Mexican, and she actually went to UNM and also medical school and residency here. She's been with First Choice since 2008 and been practicing the full spectrum of family practice, so from prenatal care and deliveries to taking care of our grandmas and our grandpas, and very happy to have her here today.
I've been here for almost 5 years. First Choice has been in the South Broadway area for 30 years. And I think that as a community health center, people have really come to trust us to provide good care for them. Like I said, I see many members of the family, and we, over the course of this 30 years, have seen families grow and change and have been constant for them. One of the things that they recognize about us is that we are accessible. So whether they have insurance, or if they have federal programs, or even depending on their circumstances, if they don't qualify for any insurance, we always have a way to serve them, and we're happy to serve them. And even understanding if their circumstances change. So if somebody loses a job or gains a job and their funding changes, we can stay constant in their lives. And I think that's something that we've been really happy to offer. Something else that we offer that we're very proud of is being a bilingual clinic. So all of our staff and all of our providers speak Spanish. And in that way, we are able to provide care to people in a setting that makes them comfortable. So if they prefer to speak Spanish, we will all speak Spanish with them and provide all of our forms to them in Spanish. Or if they prefer English, then we do that as well. So it's a real joy to work here and to serve our community.
Dr. Chavez actually is another of our homegrown, actually grew up a few streets away from here, and trained, went to University of New Mexico, the medical school, our family practice residency, trained in the Southeast Heights in a community health center, and again, showing us that yes, you know what happens, we can grow our own, and they come back and they practice again in the communities that we're from. So it is with great honor that I introduce Dr. Augustine Chavez.
Thank you. The community that we get to serve and the patients that make up that community is really the honor of working in a community health center. As Dr. Romero-Leggett said, I grew up here in Albuquerque, and ever since the time I decided I wanted to be a doctor, I knew I wanted to work for the community that I grew up in. And the main barrier to doing that, I think, for most physicians is the amount of debt that you accumulate in all of your education. I was lucky enough to go to UNM for my undergraduate, and I went to UNM Medical School, and that gave me the opportunity to have in-state tuition and the opportunities to reduce my debt as much as possible along the way. Nevertheless, the burden of medical debt can be tremendous. And this program has made it possible for me to really pursue my dream of working in a community without having the burden of debt absolutely shackling me. I think that opportunity is an unbelievable gift to anybody who can take advantage of it. Now that I've taken a role as a clinical supervisor at the clinic that I work in, another thing that I find just really remarkable about the program is that it doesn't just apply to physicians. Physicians certainly do, bear quite a bit of medical debt, but all healthcare providers in the course of their training accumulate just tremendous amounts of loans, and those are burdens for just about everybody. The program pays for dentists. My brother just graduated from dental school, and he's facing debts that are actually 3 or 4 times the amount of medical debt that I accumulated. Physician assistants, nurse practitioners, social workers, all of the care providers that we rely on in a community health center to work as a team and provide the best high quality care, as the secretary was mentioning. We try to have a team model. Each member is able to benefit from the National Health Service more, and so it's just an unbelievable opportunity that I feel very grateful for.
Well, thank you, Dr. Chavez, and really also appreciate the fact that you brought up the issue of, again, patient-centered, and that these community health centers really do bring together all of these different services, and that this isn't only about doctors, it's about all the health providers, that all of us need to really have complete health care, and the idea of this interprofessional, interdisciplinary care. So our next panelist is Dr. Arthur Kaufman, who I know probably everyone here knows. He has been at the forefront of treating and caring about the health of individuals and communities since he's been involved with healthcare. He has been a family medicine physician here at the Health Sciences Center for over 30 years, and actually first came to New Mexico with the Indian Health Service. He's currently Vice Chancellor for Community Health at the Health Sciences Center, but somebody who, again, if you think of innovative, you think Art Kaufman, you think about health of the public, you think Dr. Kaufman as well. I've had the privilege of training and working with him, and love to hear from Dr. Kaufman next. Thank you.
Thank you very much, Dr. Romero-Leggett, and welcome, Secretary Sebelius. It's a real honor to have you here. We're going to face a crisis because with the success of the Affordable Care Act, so many more people will have access to insurance, but the demand for primary care will soar, but the supply is very small relative to that need. And we have to find ways of quickly addressing this. And First Choice has really been a model that's taught us a great deal. The University of New Mexico School of Medicine was ranked 3rd nationally in the percentage of its medical school graduates who chose family medicine residencies. And so we looked at it. Well, why is that? Why are we doing so great? And the reason was, 1, they were exposed early and often to primary care and family medicine role models. 2, they were able to work in centers like First Choice that are so exciting. You have to see that, and when you watch ER and television, that's not the only exciting part of medicine. It's actually more here. And they were able to see a whole different reality that didn't appear in the hospital. And so if you look at so many of our trainees have learned here, 2/3 of the physicians at First Choice are actually our graduates. So this, as Dr. Romero-Leggett said, this is really growing our own, and they are terrific doctors. All of them are on our faculty because this really is a teaching center. As a matter of fact, First Choice was a teaching center, that is a community health center, teaching center, before the name appeared in the Affordable Care Act. And it has a lot of implications. But we know also that it's not good enough to have a terrific innovation in education unless there's a complementary innovation in clinical service. You just lose all that excitement if graduates go into a service that doesn't support any of the innovations that we talk about in education. So that's where First Choice has developed this concept, which even goes beyond the patient-centered medical home. This is really a health commons. And what that means is we're putting together and integrating primary care, behavioral health, oral health, case management, and public health, and all the outreach activities. So First Choice is a real model because it's looking at economic development locally. It's looking at youth development, and that's why it connects with local school systems. And so we want our graduates and our students to see this model. That's the model for the future, and that's why so many are attracted here. Now, people don't know this other aspect of First Choice, so I'm going to say it. This is the only state that has a public-private partnership where there's a 24-hour nurse advice line for the whole state for everybody. It gets 15,000 calls a month. That has had a reduction of about 62% of those who are planning to go to the emergency room not going to the ER, saving a huge amount of money for themselves and an unnecessary burden on the system. This is an amazing model. And Bob DeFelice and others helped start this by working with partners across the state. Another policy change which has happened nationally is the whole idea of health extension, which we stole from states like Kansas, which had cooperative extension. A great model of universities mobilizing their resources to address priority problems in communities. In this case, it was farmers, farm families in the agricultural sector. We've adopted that, modified it, and are doing it in the health sector. But this grew out of First Choice and the other community health workers, community health centers around the state. And so that model has now been funded by the Agency for Healthcare Research and Quality, by the Commonwealth Fund, and now it's in 16 states. But where did it start? It started here. So I think the whole idea of ideal training, of ideal service, of health policy, it grows from here. And universities as partners learn from First Choice and others. So thank you very much.
Dr. Kaufman, thank you for tying that all together and really giving us that perspective, that historical perspective about the health extensions and this idea that the healthcare really in these our community health centers really are linking health, education, and the economy, and the true way that they're doing that. So, Secretary Sebelius, have a few more comments?
Well, I think that while we can talk about a lot of the investments made and the programs that are offered, there's nothing like actually linking them together and seeing what happens on the ground. And I think, as Dr. Kaufman just said, the model of a medical home and a team approach to practicing medicine, utilizing all of the healthcare providers to the extent of their capacity, is really the model of the future. And I have been a huge fan of the work done in community health centers since I became secretary, because the delivery of high quality, lower cost primary care, establishing a health home, and really focusing on prevention as opposed to acute care, which is really what we need to do throughout the country. It's a lot more efficient and effective and a lot better for patients to actually identify potential problems and keep people healthy in the first place than waiting until they get sick. And we've had a great sick care system in the United States. We have not had a very good health care system. So I think starting from the community health center model, and certainly the kinds of extension opportunities that exist here, the hotline, I'm a big believer in, and Mr. Armijo talked about this a bit, but in patient empowerment. I think we have to actually have consumers begin to demand more information, more control over their own health care, and will be leading to these kind of models. But it's very exciting to be here. I've heard about the great work that you're doing, so what you're doing is resonating throughout the country, I can tell you. And I think Dr. Kaufman talked about the provider shortage that's looming in this country. And frankly, the shortage has been on the horizon for well over a decade. It really wasn't addressed in prior administrations. I can tell you that President Obama is very much aware of this, and throughout the very beginnings of the debate about the Affordable Care Act kept saying, what are we doing about providers? What happens? So we are trying to use every tool we have in Washington, from expansion of the Community Health Service Corps, which I think is a huge possibility and is tripling, but also moving payment rates for primary care providers to have more equity with specialty providers, developing possibilities for those who serve Medicaid patients to be paid at an equal rate of Medicare patients, looking at moving graduate education medical slots to primary care away from specialty care. So trying to fill the pipeline as well as look at providers, and we will continue that activity. But I'm really pleased to be here and have an opportunity to see firsthand the good work that you're doing, and can assure you that this will become part of my show and tell, because what happens when I visit someplace in the country, I then can talk about and model this as I travel around. So bringing this information not only back to our policy team in Washington, but also to make sure that others are learning from the experience here in New Mexico is something that I really look forward to doing. So thrilled to be here.
Thank you.
Thank you.